Hello, everybody, and welcome to another segment of Lessons Learned, the PF Warriors video series sponsored by FibroGen Incorporated, a leading science-based biopharmaceutical company discovering and developing a pipeline of first-class therapeutics. I'm Shelley Mathis, Executive Director of the PF Warriors International Support Group. We will be posting these video shorts weekly to educate and inform you about interesting things going on in the world of pulmonary and interstitial lung disease. So today we are very fortunate to have Dr. Leann Silhan with us. I first met Dr. Silhan several years ago when she was working for one of the big academic hospitals, and I really liked her. She and all her patients did too. She was beloved by her patients, but she made a change. She decided to change her practice to integrative functional medicine. And so therefore we have a lot of questions for her. A little about Dr. Silhan. Dr. Silhan joined Diamond Physicians in 2020 to be part of the mission to place the patient first in the practice of medicine and focus on the patient-doctor relationship. She studied functional and integrative medicine and functional immunology over the last 2 years, leaving a career in academic medicine to offer a more natural approach to healing the whole body. She believes in the body's immense innate ability to heal itself, given the right tools. Prior to joining Diamond, she was on the faculty in the Division of Pulmonary and Critical Care, first at Johns Hopkins School of Medicine in Baltimore, and then at UT Southwestern in Dallas. Then solely in a private practice in East Dallas with a focus on functional integrative medicine, and now at Diamond Physicians in the same practice area. Welcome, Dr. Silhan, to Lessons Learned today.
Thank you so much, Shelley, for that introduction. I really appreciate it. I remember first meeting Shelley, I think, through a Pulmonary Fibrosis Foundation seminar that was being given and hosted, I think, at UT Southwestern and one at Baylor. So it's great to see you again, Shelley. Thank you so much for inviting me to talk with you guys.
And thank you for joining us too. Let's get going on some of these questions. You've worked at the large academic medical institutions where you treated pulmonary fibrosis patients. What lessons were you learning from that experience that led you toward the practice in functional and integrative medicine?
Oh, great. Thank you for the question. So a little background. So when I was first on faculty at Johns Hopkins, I treated patients with idiopathic pulmonary fibrosis, but many of my patients had underlying autoimmune and connective tissue disorders, such as many are probably familiar with scleroderma, lupus, rheumatoid arthritis, Sjogren's, amongst other autoimmune and connective tissue disorders that can often affect the lungs. And that's when I first became interested in functional integrative medicine, because I wanted to have more tools in my tool belt to help treat the underlying conditions that were affecting the lungs, and felt like our tools were somewhat limited, maybe not just in pulmonary, but also just in treating the underlying rheumatologic conditions. So I began to study functional integrative medicine back in 2015, 2016, to particularly or specifically help those patients. And then I quickly realized through that, kind of diving into that world, that it could help everyone, people without either just autoimmune and connective tissue disorders, but also people with pulmonary fibrosis and other lung conditions. Through that, began to realize that our bodies are not one organ or one system, that everything affects everything else. Really interesting things I've learned along the way at specific things to help patients with pulmonary fibrosis, both in a conventional medicine standpoint as well as functional medicine.
That's fascinating. I was wondering if what your practice at Diamond Physicians looks like now, do you still see a lot of pulmonary patients, or are you seeing patients all across the board?
Both, I think so. I still see about 30% of my patients have come to me for underlying pulmonary issues, some of which are related to underlying autoimmune connective tissue disorders, and some of which are pulmonary only. So about 30% of my practice is pulmonary only, and then about another maybe 20% of my patients come to me for their general wellness in primary care, but happen to also have an underlying pulmonary condition, oftentimes asthma, which of course is quite common. And occasionally I'll see people with COPD, emphysema that just happen to have a little bit of lung issues, but they're coming to me for more of a holistic and primary care approach. And then about 50% of my practice are well or have other issues that I help them with that are not related to any kind of lung disorder.
Are you seeing any common denominator like inflammation, or something that you've begun to learn that there is something that, a common current that seems to be going through patients with chronic disease?
Yeah, absolutely. I think one over the last several years, doing this more and longer, really an oxidative stress imbalance, whether that's necessarily driven by inflammation. I think some of the time it is, but an oxidative and antioxidative imbalance is definitely a common thread in people with chronic health conditions, whether it's affecting the lungs or other organ systems. And what that means is just like, I think a simple way to think about it is, there's normal amounts of oxidative stress, and that's one way that we kill pathogens. That's one way our body heals. And then there's a balance in our body of antioxidation to balance that out. And when that becomes unbalanced, when oxidative stress is up and there's not enough antioxidative support, that leads to disease conditions, manifest in different ways in different people.
With all of the interesting things you're finding that people have in common, it just reminds me of something that Hippocrates said one time: before you can heal someone, ask if they're willing to give up the things that made them sick. Now, can you comment on this wisdom from Hippocrates and apply it to your practice?
Absolutely. Yeah, wonderful quote, Shelley. Thank you. So I think to me, the underlying kind of thread explaining that statement is looking at root cause, the root cause of disease. And if we can't find, or we don't know what the root cause is, or we don't look for it, it's difficult to reverse that or prevent it from getting worse if we don't know what the underlying driving issues are. And really, that's sort of at the root of functional medicine, is looking for that root cause and trying to figure out what is it that's really resulting in, for example, pulmonary fibrosis, because it's different for different individuals. I think what we've learned over the last 20, 30 years of looking and studying interstitial lung disease and pulmonary fibrosis is that it is the end manifestation of a disease process, but the origin comes from multiple sources. I think through wonderful interstitial lung disease expert centers that I know that the Pulmonary Fibrosis Foundation work with, our pulmonary fibrosis lawyers and the Pulmonary Fibrosis Foundation work through, really looking for that root cause is super important. As a patient, the more you can do to help your doctor figure that out, the better. And I think that the more that I practice medicine, the more that I see that, doctors and healthcare providers can, kind of help guide. But but really the health is in the patient's hands, and treatment is in the patient's hands, and hoping or helping find that root cause is also, starts with the patient, and thinking about, how did this all begin?
Well, that sounds like patient compliance is a big piece of getting well with this particular functional medicine and integrative program. Now, have you noticed any common characteristics of patients who have better outcomes than usual? Is that anything that you can describe?
Oh, yes, great question. So certainly compliance is a huge part of it, and that has to do with not just complying with what your doctor's orders are, take this medication, utilize the supplemental oxygen, do this. It's also what your outlook is, and what your personal approach. So my patients who are very dedicated to their exercise program, very dedicated to taking care of themselves, and have a good support network, do the best. For sure, people have longer, happier lives, who are really invested in taking good care of themselves.
Absolutely. And I'm wondering if there is any general advice you could give to the pulmonary fibrosis patients out here watching you all around the world, and those who don't have access to a clinic like yours, or even a functional integrative medicine doctor in their area.
Yeah, absolutely. So in general, I think there are medications that we know now help with antifibrotic medications. I think asking your doctors about those are important. That's from a very conventional, approach. There are new medications that are being developed for pulmonary fibrosis, and being a part in that development, participating in clinical trials can really help further that movement, and can help people as individuals. From a more functional integrative approach, I think it's safe to say that we know absolutely, pretty much beyond a doubt, that things like vitamin D replacement are essential for general overall health and wellness, but also have been shown to improve survival rates with people that have pulmonary fibrosis. And there's fairly good evidence that even preventing severity of illness from infections. We know this from the COVID data for sure, that a vitamin D level up to 60 is more protective than lower levels. And so I think that's low-hanging fruit, and is easy to approach no matter who you are or where you are, is make sure that your vitamin D levels are optimal. Say 60 to 80 is kind of the optimal range for most individuals. That can be can vary slightly depending on who you are and what some of the other underlying issues may be. Exercise is a huge piece, and people with pulmonary fibrosis that exercise and or participate in a pulmonary rehab program do better. They have fewer exacerbations, and appear to have longer lifespans. See if there's anything else I should touch on here with kind of general overall recommendations. I think that's probably the best I can do from a specific, or from a general, without getting far into the weeds about specific individual recommendations for people with pulmonary fibrosis.
Thank you. And probably the people in our community would be mad at me if I didn't ask you what form of vitamin D that they should be taking.
Oh, great. Yeah, that's a great question. So for most people, vitamin D3 is the correct form to be taking. I also would recommend pairing that with K2 for most individuals. The reason being more from a cardiovascular standpoint than anything else, but we know that that K2 helps. So one thing that vitamin D does, it helps you absorb calcium from your small bowel. It's one of the ways that we take in calcium is through vitamin D mechanisms in the small bowel. calcium can go multiple places. Calcium can go into the bone where we want it to be stored for increasing bone density, increasing bone health. It can also go into the blood vessels where we don't want it, and that can contribute to atherosclerosis or hardening of the arteries. What K2 does is K2 helps make sure that it deposits in the bone and not in the blood vessels. So most of the time we would recommend pairing vitamin D3 with vitamin K2, especially for individuals over the age of 50. And from a dosage standpoint, I would say a safe but reasonable dose is around 5,000 units. Now, it's hard for me to say that's the right dose for everyone. Of course, like looking at blood levels and individualizing that dose is helpful. But in general, if someone's just to say like, I don't know what my vitamin D level is, but I want to make sure that I'm taking enough or that I am taking a safe amount, 5,000 is a generally acceptable dose for most individuals to take. Some people need more, and a few people need less, but that's a fairly good average dose for most patients.
Thank you so much, Dr. Silhan. We really appreciate you being here for this segment of Lessons Learned. And thank all of you for joining us again. We'll see you next week. And thank you, FibroGen, for sponsoring this program for us. Goodbye for now.
Thanks, Shelley. Bye.